Let's look at meningitis and the relationship of meningitis with that of diabetes. What is meningitis? It is a breach in the meningeal layers because of an infectious agent or non infectious agent. And what is the sample you go behind when it comes to diagnosing meningitis? It is CSF. Now, how is diabetes related to meningitis? Whenever you go for CSF examination in case of meningitis or suspected cases of meningitis, we follow the glucose values. In case of acute bacterial pyogenic meningitis, the glucose levels have drastically fallen. The neutrophils are elevated and you will be finding pus cells. Lymphocytes will be normal. Proteins may be elevated or they can be normal. Now, what is the point of concern here? In case of acute bacterial pyogenic meningitis, we are dealing with extracellular bacteria. Sometimes it can be Candida and Aspergillus, which are fungi. So, when these are growing in the CSF, in the extracellular fluid called as CSF, they can consume vociferously whatever glucose that is available because these are rapidly growing organisms. Because of which you will be expected to know CSF glucose concentration to be normally present. A normal CSF glucose concentration is approximately equal to 40% of plasma glucose. This should be remembered. Now, if I give you a case without telling you anything about the history and say the CSF glucose is 40 milligrams per deciliter, you are bound to believe that it is absolutely normal. But it is not the case, or it need not be the case. Imagine if the patient had diabetes mellitus and his plasma glucose is 300 milligrams per deciliter, then 40% of the plasma glucose called as 300 milligrams would be 120 milligrams per deciliter. If that is the case, 40 milligrams per deciliter would be 1 by third of what is expected. That means the CSF glucose has hit rock bottom. So that is a case of acute bacterial pyogenic meningitis. This is just to tell you that there is a clear link between that of meningitis and diabetes in terms of diagnostics. I hope you will be able to use this information. All the best.